Welcome back to Montana this morning. As we enter this new year, it's usually an exciting time, but for some of our population, it can be quite challenging. So here to talk with us more about that, we welcome Dr. Michael Booth, psychologist with SCL Health Medical Group. Good morning, and thank you for joining us. Happy New Year.
Good morning, and same to you.
Thank you very much. So as I mentioned, we're entering this new year. What concern do you have?
Well, we've really had an unprecedented year. We've got a lot of folks who are hurting. Doesn't matter what part of life they come from. Pretty much everyone's hurting right now, and some folks more than others. People have been impacted by COVID-19. People have been impacted psychologically by the political race that we've had. People have been impacted by the inequalities and racial disparities that we've been dealing with. And there's a whole list of other things that we've dealt with this year. So folks are in tough shape, and our studies have shown that in the field.
Mm-hmm. And let's talk about some ways to stay healthy during this time, because like you said, in a typical year we could either have a good year or a bad year, but there's just multiple factors targeting in at this year. So give us some ways to stay in a healthy mindset.
Well, let's think about first, what is a psychologically healthy individual? Those folks are typically open to new experiences and interactions. They typically are engaged with others, and they have a balanced perspective. They're able to listen and understand folks from multiple perspectives, and then they're also able to fundamentally see the reality before them and respond to it appropriately. So folks who are suffering or struggling with those very issues are in not such a great place. So if they close off from others, they're not interacting with others, they're seeing things from a certain narrow perspective and not able to expand how they're viewing the world. And if they're isolating, we need to be concerned about how they're doing. So the things that folks can do are interact with others, open themselves to information in a way that's productive. The CDC guidance on this is very clear on these matters, that we really need to be interacting with others. We need to maintain our relationships. Now, we're going to have to do that with social distancing and whatnot, but we need to remain open to all the information. Folks who are looking at the internet way too much and find themselves siloed off in terms of the information that they're bringing into their lives. It tends to circle around and around and around, like we went through with 9/11, where people kept watching those same news clips and they struggled mightily with that. Mm-hmm. So the healthy things to do are the things that keep us seeing reality as is, keep us open to multiple pieces of information, multiple interactions, and maintaining the relationships that we've had in the past, as well as the basic healthy stuff like eating a decent diet, not watching too much TV, getting outside, stuff like that.
Mm-hmm. And I know sometimes it can be hard to, you get stuck in your own reality, so you don't realize really that you're living these unhealthy habits. So, what are some resources that people watching right now can look to or use if they're listening to this interview and saying, "Hey, maybe I need to evaluate where I'm at myself right now"?
Well, the CDC has done a nice job at supplying a whole variety of resources. And they've got a coping and stress link that outlines a whole variety of things, also basic things to be aware of. So I'm going to quote directly from that to give you an idea. We want to pay attention to those around us. People who are at higher risk of severe illness, they're going to be stressed, children and teens, people caring for family members, frontline workers such as healthcare providers, essential workers in the food industry, people who have existing mental health conditions. Those are the kinds of folks who want to be careful and mindful of how they're adjusting to the situation. Now, what we can do is take care of your friends and your family, but this should be balanced with taking care of yourself. Helping others cope with their stress, such as providing social support, can also make our community stronger. During times of increased social distancing, people can still maintain social connections and care with their mental health. Phone calls or video chats can help you and your loved ones feel socially connected. And then there's a whole variety of things that they have on that website to encourage folks.
All right, some great advice there. So as we get ready to wrap up here, is there anything else that you would like to say or mention to our viewers this morning?
Well, I think it's important for people to know where and how to get services. So if we have friends and family who are at risk, we want to pay close attention to that. There's an 800 line here in the state at 800-273-TALK. There's also even a text facility for us to speak with folks. Text MT to the number 741-741, and a crisis counselor can talk to you. If somebody needs to be seen, they need to get to the emergency room if they're in trouble. And if you're worried about somebody, reach out and talk to them. And if you're really concerned about them, avail them of these kind of resources. Therapy, support groups, things like that are really important at this time.
All right. Well, Dr. Boots, thank you so much. Any finishing thoughts here that you wanted to add before we go?
Well, given the things that we've dealt with this year, I would encourage us all to contemplate what President Kennedy told us back in 1963 when we were facing another very difficult time in our lives in the country. And he said, "So let us not be blind to our differences, but let us go also to direct our attention to common interests and the means by which those differences can be resolved. And if we cannot end now our differences, at least we can help make the world safe for diversity. For in the final analysis, our most basic common link is that we all inhabit this small planet, we all breathe the same air, we all cherish our children's future, and we are all mortal." I think that's very timely given what we're facing right now.
Yes, I'll agree with you on that. Thank you so much for your time this morning. We do appreciate it. Have a great new year and a great rest of your day.
All right, thank you.
Thank you. We'll be right back after this break.